Hello, everyone, and welcome back to Addiction Solutions with Roselle. So glad that you could join me today. I want you to do what I ask you to do every show, and that's go to my YouTube channel, Addiction Solutions with Roselle, and hit subscribe. Tell family and friends. There are numerous videos on the YouTube channel now, and some of them might be something that they need to hear. It's free. Let them know it's free. It doesn't cost them anything. There's no obligations. Just take a look at it. We finished up last week with health problems, and today we're going to talk about mental health. Now, I was a substance abuse therapist, but I did not do mental health. I worked with mental health therapists together. So this was called co-occurring treatment when you have substance abuse and mental health as the underlying issue. So I am going to use some of my notes like I did with health issues, and I hope you bear with me. There's not a lot of reading, but I'm going to give you some facts, things that others have researched, and so I don't want to lead anyone astray. So bear with me. Mental health issues that develop from using drugs or alcohol can sometimes be diagnosed as dual diagnosed, which simply means that they are treating the substance abuse problem and the mental health issue once it is discovered by a psychologist or psychiatrist. Many times the mental health issues is never uncovered. However, many times the mental health issues could have been there all the time before the individual started drinking or drugging, and in some cases the alcohol or drugs can cover up the mental health issues, or they can expose them to a greater degree. Now, this is some information from helpguide.org International. What they say is they do not constitute a medical or psychological consultation. They suggest that you see a certified medical or mental health professional for a diagnosis. When you have both a substance abuse problem and a mental health issue such as depression, bipolar disorder, or anxiety, it is called a co-occurring disorder or dual diagnosis. Dealing with substance abuse is never easy. It is more difficult when you are struggling with mental health issues. Co-occurring disorders have their own unique symptoms that can get in the way of your ability to function. It's hard to function at work, in school, with life, or maintaining a stable home life, handling life difficulties, and relating to others. It becomes more difficult because the co-occurring disorders affect each other. So these two are working against each other. You've got the substance abuse problem, whether it's drugs or alcohol, and you've got this mental health issue that you're dealing with. And so these two are fighting. They're in a heavyweight championship in the ring trying to knock each other out. When a mental health problem goes untreated, the substance abuse problem usually gets worse. And when substance abuse increases, mental health problems usually increase too. Now, this is for the family member. When you're helping someone with both a substance abuse and mental health problem, it can be a roller coaster. Yes, it's up and down, because one minute you think you've got them stable, one minute you think everything is going okay, and then boom, it explodes. And that's why it's called a roller coaster. It's up and down. Resistance to treatment is common, and the road to recovery can be long. The best treatment for co-occurring disorders is an integrated approach where the issues are treated simultaneously. So that's what I told you when I did substance abuse therapy, and I would get a client and I would read the treatment plan that was already done by their mental health provider. Usually the mental health provider was in the same agency that I was, so therefore we were able to sit down and staff this particular case. So this way we were on the same page. I knew what medications they were taking, and I also, were able to test them for drugs and alcohol to see if they were clean, because like we said here, these two are fighting against each other. If I'm giving you medication for your mental health disorder and you're steady drinking and you're steady drugging, then it's not working, and so therefore we can tell it's not working by your behavior. I'm going to read something from my notes, so bear with me again. What we are really talking about here is a person starting off with experimentation of drugs or alcohol, and they have used so long until now mental health issues have become something that concerns others. The problem could be there, as I said all the time, but in many cases it's so subtle that we blame the condition on the drinking and drugging. Many times family members notice the psychological change in their loved ones. The loved one now isolates and does not want to attend important family events because of embarrassment of their drug and alcohol drug situation, financial situation, job situation, legal situation, all of the things we have discussed in the progress chart that has got us to this point. One thing is true, you cannot fool the family, and the addict knows this. So as I covered earlier in the notes, the financial situation, the job situation, the legal situation, all of this stuff cannot be covered up by the individual that's struggling with the substance abuse problem and the mental health issue. It is sad to go from experimentation to not knowing who you are, not being able to describe how you got here. That is what is really terrifying. The addict was able to use in the past and bounce back because there was enough rubber in their bounce to bounce back. Now, when the addict tries to bounce back, there is no rubber left. The addict is turned into a hopeless, helpless individual, and believe me, the addict is no longer fooled. They know that they are in trouble. But until they admit that they are in trouble, no one can really help them. Hopefully, at this juncture of the progress chart, the addict will now first admit they are an addict, second, get some help, and third, follow directions once their life is somewhat restored. So we're going to end it right there. I'm going to get back with you next week with a little more mental health, because it is so vast and it's so wide, because we're dealing with two issues at the same time, and both are very, very important. So again, have a great day. I'll see you next week, and then please go to your video, listen to it, and enjoy. Thank you.